Hello, your host, your mentor, your educator, your friend, Dr. Hitesh, on this wonderful platform of Unacademy. Just let me know if I am audible and visible so that we are good to go with the recall session of anesthesia. Is the AV quality clear? Let me also just check at my end. Are we live? A quick nod, guys. Yeah, as I can see, we are live, and thank you for that confirmation, guys. Welcome back. A quick nod. So, hi, guys. I hope the anesthesia part from the INI-CET exam was a little bit tolerable for all of you, right? As I have got the feedback that this exam was way out of the box. Yes, it was. Because the number of topics, the questions, and the way the questions were asked, because most of them were like multiple choice questions, multiple correct answer questions. So it was a very, very, very in depth. And as I have got the feedback that 3 hours also was not enough to solve those 200 questions, right? Hi, Med Psycho. Good evening. How are you doing? So we are going to be beginning with the anesthesia INI-CET recall. And just for your information, guys, let me just take you back to the November 2022 INI-CET question paper, right? I'll just take two or three questions, and you will yourself be amazed as to how the examiner is making up the questions and what are the topics which are there, right? In November 2022, if you remember, there was one question on CPR, right? And there was one question on ARDS, right? Just take up these two questions and take up this today's, that is yesterday's INI-CET paper. You will see that these two topics are repeated the way it is, right? They have not even changed the settings or the way the topics are asked, right? Similarly, right? In ARDS, they had asked about ventilator settings in the last session. In CPR, they had asked about the quality. They had asked about different options that they have given about the CPR. This time also, they have asked about the ventilator settings in an ARDS setting, right? But it was a little bit clinical scenario that they've asked. Also, CPR was asked the way it is, right? So always remember that the topics are repeated, right? It is not that the topics are not repeated. Particularly in short subjects, they do not have any other choice. And what is happening in last 2 3 years? Same topics are going on. Like take the case of ARDS. Since the time of COVID-19, we have seen one question on ARDS or associated ventilator settings being asked, right? So this is how the trend has been so far, right? So let us dive straight into the first question, which was from the CPR, right? That is, which of the following are incorrect regarding high quality CPR, right? What it is asking? High quality CPR, which of the following is incorrect? Remember, this is a girlfriend googly question, right? As I have told you, incorrect, untrue, all of the following are true except. So you have to keep your mind open when you are solving such questions and read the question twice and also the answer twice, right? So let me know what have you marked for this, right? Option A is chest compression rate is 100 to 120 per minute. Ventilation is 20 to 25 per minute. Allow for adequate chest recoil and depth of chest compressions up to 5 to 6 centimeters, right? So what have you marked? Yes, PK says B, Med Psycho says B, very good. Faisal says B, right? Dr. Jyoti says B, yes. Wonderful, guys, wonderful, yes. Okay, so ventilation or respiratory rate was not 22 exactly. It might be less or more. 20 to 25 might be the option. So, what are the high quality CPR indicators that we have to know, right? So, what are they asking? They're asking you from the most of the options are regarding chest compression, right? Chest compression, allow for adequate chest recoil, rate of chest compression, right? Depth of chest compressions. So, what exactly is the high quality CPR and particularly in chest compressions, right? So, when it comes to chest compressions, what is the rate of chest compression, guys? The rate of chest compression is 100 to 120 per minute, right? It is not less than 100 or not more than 120, right? It has to be in the range of 100 to 120 per minute. This is the first thing that we should know, right, regarding chest compressions. Second, what is the depth of chest compression that is there, right? Here, since we are taking it as adult, right, what is the depth of chest compression? It is 5 to 6 centimeters, right? Exactly. Yes, depth is 5 to 6 centimeters, right, Jyoti? Yes, Faisal, exactly correct. 5 to 6 centimeters is the depth of chest compressions, right? If it would have been a child or a neonate, then it would have been anterior to the posterior diameter of the chest, that is 1/3 of the AP diameter of the chest, right? Since it is adult, 5 to 6 centimeters is the depth of chest compression which has to be there, right? But after every chest compressions that you give, you should allow for the chest to completely recoil. So allow for chest to completely recoil, right? You should not just keep on pressing 1 and 2 and 3. You should allow 1, again come back, 2, again come back, right? That is allow for the chest to recoil so that the blood again comes in and fills the chambers of the heart, right? Then minimize the interruptions, right? Minimize interruptions. What do we mean by that? Minimize interruptions to less than 10 seconds. What do we mean by that, guys? In between chest compressions, or whenever you are changing the positions, or whenever you're giving some orders, or whenever anybody who's giving chest compressions want to take a break or change of hands happen, the interruptions between them has to be less than 10 seconds, right? So minimum interruption between chest compression has to be there, right? So what are the options here? Chest compression rate 100 to 120 per minute. Is it correct? Yes, it is correct. So I'll write a true statement. Ventilation we have not yet seen. Allow for adequate chest recoil. Yes, we have to allow for adequate chest recoil. What is the depth of chest compression? 5 to 6 centimeters. Yes, it is correct. That is 5 to 6 centimeters, right? Even without coming to the ventilator part, you can directly say that option B is incorrect, right? But let us come to the ventilator as well, right? So what is the respiratory rate in adults that we have to keep, right? It is 8 to 12 breaths per minute, right? It is 8 to 12 breaths per minute. That is the respiratory rate in adults, right? And what about children? The recent mode guidelines says that it is one breath every 3 seconds. That is around 20 breaths per minute, right, in children. So what are the options here? Ventilation at 20 to 25 per minute. Is it correct? No. It has to be 8 to 12 breaths per minute, right? That is the ventilation rate. So this is the incorrect or false statement. So correct answer here is option B. All of you have marked it correct. Well done, guys. So this was about one question from CPR, right? Moving on to the next question. Patient of pneumonia or pancreatitis, right, is on ventilator with the following settings of respiratory rate 14 per minute, SpO2 maintained normally at 100% with FiO2 of 90%, right? Tidal volume 420 ml, pH of 7.33 with PEEP of 12 centimeters of water. PCO2 here is 48 millimeters of mercury, right? Weight is around 50 kg of that person. What is the next step in the management of this person, right? Increase PEEP to 14, decrease FiO2, decrease the respiratory rate, or increase tidal volume, right? What is the next step of management? Tell me, guys, in the comment section what should be done in this particular individual for the next step of management. Faisal says option C, that is decrease RR, okay. But Psycho says that we will increase the tidal volume. It is 420, so we can increase up to 500, right? Jyoti says again it is D, that is will increase the tidal volume. Faisal says option C, that will decrease the respiratory rate. What is the respiratory rate? It is 14 here, alright. Yes, again, what is the answer here? Try and write down your answers in the comment section so that you know what have you written in the exam. Decrease respiratory rate is what PK says, right? Come on, we'll write down everything step by step here, right? So what is the pH? right? pH is 7.33, right? On ABG we are writing the pH is 7.33. So what is the PaCO2, right? What is the PaCO2? It is 48 millimeters of mercury, right? And I believe PaO2 was also given. PaO2 was somewhere around 1110, right? If I am not wrong, PaO2 was around 110. These are all your ABG findings, right? Even bicarb was given somewhere around like 18, right? Even bicarb was given somewhere around 18, right? So PaCO2, PaO2, pH, all these things are given, which was the ABG values, right? Now let us come to the ventilator settings. What were the ventilator settings? Respiratory rate was 14 per minute, right? Respiratory rate was 14 per minute. What were the other ventilator settings? FiO2 is kept at 0.9 or 90%, right? Tidal volume. Tidal volume is 420 ml, right? PEEP. PEEP is 12 centimeters of water, H2O. PEEP is 12 centimeters of water, right? So weight is 50 kgs, right? In a 50 kg individual, the ventilator settings are given, the ABG is done. Now what are we supposed to do next in this step of management is what is being asked, right? But what is the patient? Patient is a known case of either pneumonia or pancreatitis. That means there is something related to sepsis, and this points us to acute respiratory distress syndrome, again ARDS, right? So what are the ventilator settings that we need to keep when we are managing a patient of ARDS, right? Yes, Faisal, it seems like everything is within normal limits, right? So let us look into it one by one. So what is the normal limit of your pH, Riz? Tell me in the comment section what is the normal value of pH. It is 7.35 to 7.45, right? 7.3 to 7.4, 7.35 to 7.45. This is your normal pH value, correct? Yes. What about PaCO2? Normal value is 35 to 45. What is given here? 48. pH 7.33, almost on the normal side, right? Then comes your PaO2. PaO2 is what? It is 110, which is given here. What is the normal value of PaO2? It is more than 60 that we consider, but to be on the safer side, it is 80 to 100, right? More than 60 is what we consider, but 80 to 100 is what it is, right? Yes, Faisal, 7.35. Yes, Velu Priya, exactly correct. 7.35 to 7.45 is your pH, that is the normal value. Well done. Bicarb also on the normal side, 18 to 21 is what we take it as normal, right? So ABG denotes that everything here is normal, right? Compared to that, now look at the ventilator settings. Respiratory rate is 14 per minute, right? In adults, usually we keep it at 8 to 12 or 8 to 14 per minute. 8 to 12 is the ideal thing, right? FiO2 is 0.9, that is, it is close to 100%, right? But what is the SpO2? What is the SpO2, guys? SpO2 is already 100% here, right? So do we need to keep this high FiO2 to maintain the SpO2 of 100%? Absolutely not, right? So here what is happening? It is a ARDS patient, right? ARDS patient. So what are the ventilator strategies in ARDS patient, right? It is lung protective ventilation, right? We go ahead with lung protective ventilation strategies, right? In a patient with ARDS, we go ahead with lung protective ventilation, right? So how do we go about with that, guys? How do we go about with that? We give low tidal volume, one, right? We give increased respiratory rate. Both of these things are done to maintain minute ventilation of that patient, right? So these are some of the lung protective strategies. Also, we can give PEEP in this patient, and we can give right from 4 to 12, and we can even increase up to 16 centimeters of water, right, if need be, right? We can increase the PEEP up to from 4, we can start, increase it to 8, 10, 12, and even up to 16 centimeters of water if need be, right? So these are some of the lung protective strategies. What is the respiratory rate that we can go off with? Yes, we can start with 8 or 12 per minute, and we can go up to 30 to 35 breaths per minute just to maintain the minute ventilation of that patient, right? So these are some of the lung protective ventilation strategies that we have to maintain and manage for a ARDS patient, right? Also, guys, also know FiO2, we generally try and keep it below 0.6 or below 60%, right? We generally do not prefer FiO2 of more than 60%. Why? Again, this will lead to oxygen radical formation, and this will in turn cause worsening of the ARDS syndrome, right? And it will be a hazardous for the patient. So always we try and maintain or keep FiO2 less than 0.6 or less than 60%. So what is here? FiO2 is more than 0.9 despite FiO2 being SpO2 being 100%. So can we increase PEEP to 14 here? Yes, we can, but do we need to increase PEEP? No, because already SpO2 is 100%. So we will do that? No, we won't do that, right? Will we decrease FiO2 immediately? Yes, because FiO2 here is 0.9%, which is already on the higher side. Despite that, SpO2 is 100. PaO2 is well within the limit, that is 110. It is on the higher side where we want PaO2 to be around 80. More than 60 is more than sufficient for us, right? So it is way higher than the normal values. So do we want to decrease FiO2? Yes, we would surely want to decrease FiO2 as the first step of measure here. Do you want to decrease respiratory rate in this case? Absolutely not, because ventilatory parameters are on the normal side. Respiratory rate is 14. Even in fact, if we can go up to 30 breaths per minute, right? We can increase the respiratory rate, not decrease here. So again, this is ruled out. Can we increase the tidal volume? Absolutely no need, because we have to go ahead with the lung protective measures, and tidal volume is 420 ml in a 50 kg weight. So what is the low tidal volume? 6 to 8 ml per kg of body weight is the lung protective strategy for this ventilation patient of ARDS, right? So in a 50 kg patient, what should be the tidal volume? It should be around 50 into 6, 300 to 50 into 8 is 400 ml of your tidal volume. So what is here? It is 420, which is again on the normal side. So will we increase the tidal volume? No need, because it is already on the normal side that we want to ventilate the patient with. Is this question clear? Sir, where all can we increase FiO2 is what Faisal is asking. Wherever PaO2, if you have done ABG, it is less than 60, right? Millimeters of mercury. Wherever SpO2 is less than 90%, right, or less than 92%, you can keep on increasing FiO2 and you can keep on increasing P, right? So these are the places where you can keep on increasing FiO2 whenever you get PaO2 less than 60, SpO2 less than 90 or 92%. All right. Is this question clear, guys? These two questions, I'll call it as repeat of November 2022 INI-CET, right? So if you have been through that recall of the November, you should be able to answer these two questions. And either ways, if you take up last 5 years question paper, be it of INI-CET, be it of NEET PG, be it of FMG, you will get all these questions there as well, right? Moving on to the next question. Which test is depicted in the following image? Options are Allen's test, Roos test, elevated arm stress test, or Adson test, right? What is being done here? The patient's arm and the hand is stretched out, and the examiner is pressing on the two aspect, that is the radial and the ulnar aspect, right? So what is being done here? Look, you can look that there is a blanching of the hand which has happened, right? So which test? Yes, most of you, almost all of you, Faisal, Med Psycho, Dr. Jyot, all of you have given correct answer. Yes, it is Allen's test. Why do we perform? Whenever we want to cannulate the radial artery, right? Whenever we want to cannulate the radial artery, or whenever we want to cannulate, sometimes we have to cannulate ulnar artery as well. So whenever there is arterial cannulation, we do this Allen's test. What it actually tells you? It tells you about the collateral circulation of the hand, whether it is proper or not. Why do we require that? See, whenever you are cannulating a radial artery, right, you are inserting a cannula there. What happens at time? There may be a clot formation, or there can be spasm of the arteries, right, which can lead to insufficient blood supply of the hand, right? If the collaterals are not developed, this spasm can further aggravate to ischemia, which can lead to necrosis, right? So in order to avoid this complication, what do? We go ahead with the Allen's test. What happens in Allen's test? You ask the patient to blanch the hand. Then once the hand is blanched, what will happen? We will press upon the radial and the ulnar aspect of the patient, right? And then once the fist is open, you will release one aspect. First the ulnar aspect, then again second time you will release by pressing on the ulnar side, the radial aspect you will release, right? So you should look and how much time does the blanching of the hand goes off, right? Usually it should go off within 5 seconds, but we do take 5 to 10 seconds as the normal value, right? If it takes more than 15 seconds, that means the collaterals are not developed, right? And you should avoid cannulating such arteries, because if you cannulate such arteries in which you require Allen's test or time is more than 15 seconds for the hand to come back to the normal pinkish shape, what will happen? If the artery goes into spasm, you will end up the patient with ischemia and necrosis of the hand, and ultimately, if it is very worse necrosis, you might have to amputate the hand, which is not at all advisable, right? So it is done to check for the patency of collateral circulation, and this test is Allen's test, right? So these were the three direct questions from anesthesia which were asked, right? A couple of questions which were overlapping with pharmacology when it came to like your opioids was also asked. Then with ENT about the artery which was about the nasal block, right? One of the nerve which is blocked was asked. So these were the overlapping questions, but these were three direct questions from anesthesia which were asked: CPR, ARDS, and Allen's test, which we all have seen during our preparation. All right. So I hope all of you have given these three questions correct answer from the anesthesia point of view, right? So who all are targeting for the next year or for the upcoming INI-CET? Let me just tell you guys, there is a 20% off which is going on all Unacademy subscriptions, right? Be it 12 months, 6 months or 9 months, you can avail 20% off. And what you will get? You will get notes which is free of cost along with this subscription. You will get NEET PG vitals, right? So everything we have condensed and delivered to you in recorded format along with the live classes which are going on, right? So this is the best thing that can happen. And also there is a free extension of 3 months no matter what, right? If you take 9 months, you will get extra 3 months. If you take 12, you will get extra 3 months, right? So all these things are there, and this 20% off is going on till 13th of May, right? Also along with that, there is this next batch. I am doubtful whether there will be a next exam for the upcoming session, because still there is nothing conclusive yet, because FMG dates are not yet declared. So there is still that element of doubt which is going on that next might come up, right? Because by now FMG date should have been declared. So next exam is a high possibility which can come up in the upcoming session, right? So let us see, let us wait and watch. So all those who are targeting for that next year, that is 2024 NEET PG or next whatever it is, you can go ahead with this 8 months duration batch. For getting the 9 months subscription, you will get 2 months extra, right? You will get notes, you will get this recorded session, and you will get the best of educators which are there, right? And this batch has started from 29th of April. So just now we have started this live batch. Along with that, you are getting recorded plus the notes. All right. So I hope you guys have solved these questions when it comes to, from the anesthesia perspective. And I wish you all the best for your results. I believe the results will be out in a week's time. Do let me know how did you fare in the exam. All right. Thank you all for joining in for today's session. Any queries, you are more than welcome to ask in the comment section, right? Anytime, if you have any doubts, you can ask the question in the Unacademy app. You can download the app, you can subscribe and like this video so that you will get notifications whenever we are coming up with such sessions in the exams, right? Thank you, MedPsycho. Thank you, Faisal, Jyoti, everybody else for joining in. Don't worry. Faisal, I am unable to improve my score, right? First thing that you should think when you are solving any MCQs, right? Whether you have read that topic or not, right? If you have read that topic, whether you understood the concept part of that topic or not, right? If both these things are clear, that means you fall in the most common category, that is silly mistakes, right? And I'll tell you, 80% of us fall in this category of silly mistakes, right? So we have read at least once that topic, we have tried to inculcate the concepts, and when we are trying to solve MCQs, what happens? We are performing silly mistakes, right? The only thing that you can overcome this and avoid the silly mistakes is by solving more number of MCQs, right? But if you have not read the topic, or if you have not even understood that concept, you have to go back to the theory and complete that topic from the theoretical aspect with your concepts and revision, right? Only then will you be able to improve your scores, right? So analyze the MCQ, analyze the place from where your doubts are coming from, right? Why you are not able to improve the score. Look at the topics, look at the subject, look at the individual part of that topic that you are not able to solve. You will find a common link between all of them. All right. So TND would help me improve. Yes, of course, Faisal. TND would absolutely help you and improve. Jyoti, the tip for the next exam is to just follow your routine, right? Don't get into the FOMO thing, or don't be afraid that next RA hai, so what will I do, right? It will be the same for every one of you who will be attending the exam in the upcoming year, right? So all of us are in the same boat, right? Nothing is like, no one is like out of this boat. So first of all, don't be anxious. Don't be in that FOMO mode. Arey, what will I do? I'm missing out on this, on that. Just don't worry about that. Right now, prepare the way you will prepare for a NEET PG preparation, right? Just be with that confidence. Just go with that clarity. And the one thing that I want you to do right now is to finish off with your first reading if you have not done so far, and start with revision as soon as possible, plus solve MCQs on the way, right? This is where most of us are gonna miss out, right? We do not solve MCQs, that is where we miss out in the exam, right? So I just want you to focus, and just stay focused for the NEET PG right now. If the next comes, well and good, it is for everyone. Everyone is in the same boat, nothing to worry. All right. All right. Any other questions? Any other queries? All right, so that's it, guys. So I hope to see you in our next session. Till then, this is your host, your mentor, your educator, your friend, Dr. Hitesh, signing off for the day, guys. Bye bye. Take care. Stay blessed, stay disciplined, and stay motivated, guys.